And for women who have lost one or both breasts to cancer, breast reconstruction is an integral part of the treatment. But our next guest says it's important to set up a plan first. Dr. Beth Collins is a double board certified plastic surgeon in general surgery and in plastic and reconstructive surgery, and has been awarded for her breast reconstruction work. Dr. Beth Collins, thank you so much for being here.
Thank you.
Let's just talk about right off the bat, when a person is diagnosed with breast cancer, what should they do?
Well, the first thing they need to do is get somebody that they really trust and feel comfortable with who's going to manage their breast cancer. But what I'm here to try and convey to people is that I think it's important that every single person who is diagnosed with breast cancer come and see a reconstructive surgeon. And I do a lot of breast reconstruction, and I actually have something very personal to me in that my childhood best friend was recently diagnosed with breast cancer, and when she came to me, I realized that she wasn't getting all the information. So that information is not only coming from the person who's going to take the cancer out, but also the person who's going to reconstruct and make you whole again. So you don't have to go. It used to be that people had some deformities after breast cancer, and that's absolutely not the truth anymore. And so in order to get all that information and to know all the options that are out there for you, you do need to see a reconstructive surgeon, everybody. Even if you decide not to have reconstructive surgery, it's important that you absolutely know all of your options before you get your treatment, because sometimes those reconstructive efforts have to happen in conjunction with the treatment.
I see. And we really should mention, insurance covers this.
Absolutely. So, and unfortunately, only about 30% of women who have breast cancer avail themselves of that. So I'm not seeing everybody who comes in. They kind of go a certain route, which may be fine. You know, there are treatment options that don't involve reconstruction, and that's fine.
At least know what's out there, right?
At least know what's out there. And sometimes the options that are out there that are more new and innovative, the general surgeon or the person who's actually treating the cancer may not know about them. And so it's important just to come and have the conversation. Something I do see is that people, as soon as they get the diagnosis of breast cancer, their drive appropriately is to get into their doctor as soon as possible to get that taken care of. And so, at least in my office, I make sure that somebody who has this as a problem gets on the expedited list. They're not going to be waiting weeks to see me. They'll be seen the next week and get through the system very quickly.
And how does what's the procedure? There are a lot of options when it comes to breast reconstruction.
There's a ton of things that you can do, and it is a long conversation. Usually when somebody's coming into me for a consultation for reconstruction, I block off an hour of time to talk with them because there's so many different things. I always recommend that somebody do a little bit of research on even on the internet, because you get some good information, also some bad information, but at least it's a jumping off point that I could start to have the conversation.
Doctor, let's briefly talk about two of the options. You could go with breast implants or a natural body tissue flap.
That's right. So if you decide, and some women will decide to have a mastectomy just because they don't want to have to worry about the remainder of the breast tissue. Some women will have lumpectomies and only get a portion of their breasts removed, which is fine and may not need a reconstructive surgeon. So if somebody's decided to have a mastectomy, you could have something as simple as just having a breast implant put under. It's a fairly easy thing to go through, not a huge amount more than the surgery that you're going to need just to have the cancer removed. And some people choose to be reconstructed with their own tissue. So actually you could use the tissue from a tummy tuck to recreate a new breast. Exactly, and you shift it into a new position and create a new breast using that. So those are just two of very many options. So there's a ton out there, so much that needs to be discussed
while you're doing this.
Yeah.
Doctor, tell me about what's going on October 18th in your office.
Okay, so I've paired up with a wonderful organization called Get in Touch. It's directed toward younger girls, because we are actually seeing breast cancer in younger and younger women. So this organization is a great thing to help educate girls grades 5 through 12 into sort of knowing their body. So on the 18th, all the proceeds from all of my cosmetic work, 10% of what I have on that day is going to go to that foundation.
Very good. Dr. Beth Collins, thank you so much for all the options and the information. And to learn more about breast reconstruction, visit bethcollinsmd.com or call 203-689-5295.